Telehealth. Let's talk about it. Did you know that in 2024, 91% of hospitals reported having a telehealth program established in their facilities? An increase could be seen since 2023, when only 85% of hospitals had an established telehealth program. How could telehealth, which has the potential of providing equitable healthcare to all, actually widen the gap between those who can benefit from it and those who can't? Before we continue, we must define telehealth. Telehealth is the broader use of electronic and digital media for health and healthcare. For our purposes, telehealth will be defined as the use of ICTs, information and communications technology and services, to exchange health information and provide healthcare services across geographic, time, social, cultural, and political barriers. To be a little more specific, here are six guidelines that outline what telehealth is and what its ultimate goals are. 1. Uses any form of ICT device. 2. Covers preventative, promotive, plus curative aspects of health. 3. Utilizes video conferencing. 4. Interactive, either synchronous or asynchronous. 5. Links healthcare workers to the general population, aka patients. And 6. Use as an alternative or complementary approach for any health issue. Telehealth is able to provide resources and care for patients in rural areas or in areas with provider shortages. It reduces patient travel and wait times, which can allow for comparable or improved quality of care. Telehealth can reduce stress, increase convenience, which ultimately can increase patient satisfaction. Some historians describe the first example of telehealth occurring in the late 1950s and early 1960s. A closed circuit microwave television was used in order to communicate, educate, and continue research between individuals at Nebraska Psychiatric Institute and Norfolk State Hospital in Nebraska. Projects after that demonstrated how telehealth could be beneficial, especially in cases where there were geographical barriers. To this day, telehealth has been a prominent tool in the healthcare system. In the United States in 2020, 76% of hospitals connected with patients using some form of telehealth services. The COVID 19 pandemic transformed how healthcare and medicine was conducted. Telehealth became a basic need for the general population, healthcare providers, and patients with COVID. Telehealth allowed patients to interact virtually with their providers and get assistance with their health problems. It was a valuable tool during the pandemic, which allowed many people to connect virtually with a healthcare provider and get assistance. But did telehealth and its services really benefit all people? The next slide will go more into depth on telehealth usage in minority groups. As of right now, I would like to leave you with some information surrounding minority groups and telehealth during the pandemic. A study conducted found that the utilization of telehealth practices were found to be less common among Black and Hispanic patients, as well as lower income households. Another study that was conducted looking at the usage of telehealth in ethnic minority groups before and during the pandemic also showed that the use of telehealth among Hispanic people was lower than the rate of other racial groups. The lower usage could be associated with language barriers or barriers to accessing technology. It must be ensured that the patients are equipped with the appropriate tools in order to participate in telehealth. These studies suggest that there are still inequalities associated with telehealth, meaning that justice is not being served. This infographic illustrates the telehealth usage among minority groups. It was found that those who identified as white were more likely to use telehealth services compared to Black or Hispanic populations. Households who earn less than $50,000 per year were less likely to use telehealth services. Then those who had private or public insurance were about 3 times more likely to use telehealth services compared to those who were uninsured. Let's talk about the four pillars and how they each play a role in telehealth. Autonomy. Two studies done in Sweden found that autonomy could both be improved as well as diminished through the usage of telehealth for elderly people. On one hand, telehealth could promote and increase freedom and individual choice by allowing elderly people to remain in their own homes while attending consultation. On the other hand, some elderly people thought that the usage of telehealth services contributed to their isolation and felt like they were being made captive. Informed consent is essential with any healthcare encounter, and telehealth is no different. Patients should not be forced to participate in virtual services if they do not wish. Some recommendations that have been made to improve autonomy in telehealth is a multi-pronged approach that incorporates ethical principles into practice, which include regulations, standards, and codes of ethics. Beneficence. An analysis that dealt with telehealth and the four pillars showed that 19 out of 49 papers mentioned beneficence. All 19 authors noted that telehealth has the potential to benefit people by providing assurance, increasing an individual's confidence in managing their health, and reducing the dependence of family. Telehealth can be a great tool, But some people do prefer in person visits. The overall reason that people prefer face to face visits is that they receive a more accurate diagnosis and examination. Some people want that physical interaction and relationship with their provider, and if they feel like they have to use telehealth, then their overall well being is not fully being taken care of. Non maleficent. Telehealth has the potential to actively promote safety by allowing telephone and radio lines to be left open so providers could check in on patients at regular intervals, which acted as a security against harm occurring in the home. It was noted, though, that potential for harm is more prevalent due to telehealth equipment. Some authors say that telehealth equipment, like video phones that are in the home, can have the effect of stigmatizing a person and causing them shame and embarrassment. Also, healthcare providers could choose virtual options or remote communication rather than in person care, which could potentially put patients at risk if they have difficult or higher risk needs. Justice. We have already mentioned how marginalized communities could have a harder time accessing and utilizing telehealth services. We have seen through the statistics that people socioeconomically and racially can be affected and may not use these services. The information that has been presented shows that there are limitations, but there also can be solutions that can be implemented to overcome those limitations. So, what do you think? Now that you know a little bit more about telehealth and its benefits, as well as its possible ways of violating some of the pillars, what do you think about it? Is it a good technological advancement? Is there a way to tighten some of the gaps to ensure telehealth provides beneficial services to all, as well as minimizes potential risks that the pillars could face?